8 strange signs of stomach cancer. The human body whispers before it screams, especially with stomach cancer. While modern medicine has made tremendous strides in treating this once devastating disease, timing remains absolutely crucial. What's truly remarkable is that stomach cancer, when caught in its early stages, has an astounding cure rate of nearly 100%. Yet countless people miss these early warning signals, mistaking them for ordinary digestive issues. Before refrigeration became widespread, stomach cancer claimed more lives than any other form of cancer worldwide. While those numbers have decreased thanks to better food preservation methods, this disease continues to impact thousands of lives each year. What makes gastric cancer particularly challenging to detect is its subtle beginning. Symptoms that could easily be dismissed as everyday digestive problems or stress-related issues. What you're about to discover might surprise you. 8 strange and often overlooked signs of stomach cancer that medical science has identified through years of research. These aren't just random symptoms, they're documented warning signals your body might be sending. Some of these signs appear in places you'd never expect, far from your stomach area. Others might seem so ordinary that you'd typically ignore them. Understanding these symptoms could mean the difference between early detection and a late-stage diagnosis, and the information you're about to learn could literally save a life. 1. Persistent feeling of fullness. The earliest red flag of stomach cancer often manifests as an unusual and persistent feeling of fullness, a sensation that goes far beyond normal post-meal satisfaction. Imagine feeling completely stuffed after just a few bites of food, as if your stomach has suddenly shrunk to a fraction of its normal size. Medical experts call this symptom early satiety, and it's one of the most frequently overlooked warning signs of gastric cancer. This isn't the typical fullness you experience after overindulging at a holiday feast or eating too quickly. Instead, this sensation persists even when consuming small portions, making every meal an uncomfortable challenge. Your stomach might feel bloated or tight, and the discomfort often lingers for hours after eating. What makes this symptom particularly concerning is how it develops without any apparent cause. You haven't changed your eating habits, started new medications, or experienced recent illness. The science behind this symptom reveals why it occurs. As cancer cells develop in the stomach's lining, they can affect the organ's natural ability to expand and contract. This interference disrupts normal digestion and creates that persistent feeling of fullness. Think of it like trying to fill a balloon that has lost its elasticity. Even a small amount of content feels like too much. When this sensation becomes a regular occurrence, particularly when it's accompanied by discomfort or mild nausea, it warrants serious attention. 2. Changes in stool color and characteristics. Another critical warning signal of stomach cancer reveals itself through changes in stool color and characteristics. When your stools become noticeably darker and develop an unusually strong odor, it might indicate internal bleeding within your digestive system. Medical professionals refer to this condition as melena, the presence of digested blood in feces that creates a distinct dark, almost black appearance. Understanding why this happens helps explain its significance. When stomach cancer causes bleeding in the upper digestive tract, the blood travels through your digestive system, undergoing chemical changes that darken it significantly. What makes this symptom particularly dangerous is its intermittent nature. The bleeding often occurs in patterns, active for a while, then stopping, only to start again later. This sporadic pattern can create a false sense of security when the bleeding temporarily subsides. Many people make a critical mistake when noticing darker stools. They rely solely on at-home testing kits to check for blood. However, these tests can miss intermittent bleeding entirely, providing misleading negative results even when a serious condition exists. The sporadic nature of tumor bleeding means that timing is crucial for detection. A single negative test doesn't rule out the presence of gastric cancer, and waiting too long to seek proper medical evaluation can allow the disease to progress undetected. 3. Profound fatigue. A cluster of seemingly unrelated symptoms. Profound fatigue, diminishing appetite, and unexplained breathlessness often signals something serious occurring in your stomach. These symptoms typically emerge when stomach cancer triggers anemia, a condition where your body lacks sufficient healthy red blood cells to carry oxygen effectively throughout your body. This explains why simple activities suddenly leave you exhausted. Think of your blood cells as a delivery system, carrying vital oxygen to every part of your body. When stomach cancer develops, it can cause blood loss through subtle bleeding you might not notice. Additionally, the cancer's inflammatory effects can interfere with your body's ability to produce new blood cells. Imagine trying to run a delivery service with only half your usual fleet of trucks. Everything slows down, and some areas don't get their deliveries on time. This combination creates a domino effect in your body. As your blood's oxygen-carrying capacity decreases, your heart works harder to compensate, leading to shortness of breath even during mild activities like climbing stairs or walking short distances. The fatigue isn't the typical tiredness that comes from a busy day. It's a bone-deep exhaustion that doesn't improve with rest. Your appetite often diminishes too, partly because your body's energy systems aren't functioning optimally, and partly due to the cancer's direct effects on your stomach. 4. Persistent burning sensation. A persistent burning sensation in your upper abdomen or chest area might masquerade as ordinary heartburn. But when it comes to stomach cancer, this burning takes on a more sinister character. Unlike occasional acid reflux that flares up after spicy meals or lying down too soon after eating, this burning sensation becomes a frequent, unwelcome companion that rarely takes a break. Understanding this symptom requires knowing how stomach cancer affects your digestive system's normal functions. When cancer develops in your stomach lining, it can disrupt the natural protective barriers that usually prevent stomach acid from causing irritation. Imagine your stomach's protective lining as a sophisticated waterproof coat. When cancer damages this coating, the sensitive tissues underneath become exposed to harsh stomach acids, creating that persistent burning sensation. What makes this symptom particularly concerning is its resistance to typical heartburn remedies. While regular antacids might provide temporary relief for normal heartburn, the burning sensation associated with stomach cancer often persists despite these interventions. The pain might start in your upper abdomen and radiate upward, creating discomfort that feels like it's traveling from your stomach to your chest. This isn't the kind of heartburn that comes and goes with meals. It's a more constant presence that can worsen over time and may even interrupt your sleep. 5. Swollen lymph nodes in unexpected places. An often overlooked but significant warning signal of stomach cancer appears in an unexpected location: your lymph nodes. When these small bean-shaped structures become swollen, particularly in areas like your armpits or above your collarbone, they're sending an important message about your health. Unlike the temporary swelling you might experience during a common cold or flu, these swollen lymph nodes persist without any obvious infection present. This symptom typically emerges in more advanced stages of stomach cancer, when cancer cells have begun to spread beyond their original location. Your lymphatic system acts like your body's internal security network, with lymph nodes serving as checkpoint stations throughout your body. When cancer cells start moving through this system, these checkpoints become enlarged as they attempt to contain the spread, much like a security system raising an alarm. The location of these swollen lymph nodes makes this symptom particularly noteworthy. Finding enlarged nodes far from your stomach, such as near your collarbone or in your armpits, suggests that cancer cells have entered your lymphatic system and are traveling to distant areas. Unlike the brief swelling that accompanies infections, which typically resolves within a few weeks, these enlarged nodes remain persistent and firm to the touch. This ongoing swelling, especially when accompanied by other stomach cancer symptoms, serves as a crucial indicator that requires immediate attention. 6. Unexplained weight loss. Unexplained weight loss serves as a powerful warning signal of stomach cancer, one that often creeps up silently. When your body starts shedding pounds without any changes to your diet or exercise routine, it's like your internal systems are sending up emergency flares. This isn't the gradual weight loss that comes from healthy lifestyle changes. Instead, it's a significant drop of 10% or more of your body weight within a 6-month period. This dramatic weight change occurs through multiple mechanisms. As cancer develops in your stomach, it can interfere with your body's ability to digest food properly and absorb essential nutrients. Think of your digestive system as a sophisticated processing plant. When cancer disrupts its normal operations, even if you're eating the same amount of food, your body struggles to extract the nutrients it needs. Additionally, cancer cells themselves can alter your metabolism, causing your body to burn calories at an unusual rate. The weight loss often accelerates as other symptoms develop. You might find yourself eating less due to that persistent feeling of fullness we discussed earlier, or because food doesn't taste the same anymore. Some people experience nausea or difficulty swallowing, further reducing their food intake. This creates a concerning cycle where decreased nutrition combines with the cancer's effects on your metabolism, leading to increasingly rapid weight loss that can't be explained by normal causes. 7. Pain and bloating. Pain and bloating in your upper abdomen represent another crucial warning signal of stomach cancer. But this isn't your typical stomach discomfort. The pain associated with gastric cancer often feels different from ordinary indigestion or temporary bloating. It manifests as a deep, persistent ache in the center of your upper abdomen, an area doctors call the epigastric region, just below your rib cage. When stomach cancer develops, it can cause inflammation and changes in your stomach wall, leading to this distinctive discomfort. As tumor cells grow and multiply, they can irritate nerve endings and create pressure within your stomach. This results in a pain that doesn't follow the usual patterns of digestive upset. It might not relate to meals, and it often persists regardless of your eating habits or position. Many people make a critical error by reaching for over-the-counter medications to mask these symptoms. While these medicines might temporarily relieve the discomfort, they can inadvertently hide a more serious underlying condition. The bloating that accompanies this pain often feels different too, more persistent and less related to what you've eaten. Your stomach might feel constantly swollen or tight, even first thing in the morning before eating anything. This combination of persistent pain and bloating, especially when it continues for several weeks without improvement, serves as a vital warning sign that something more serious might be developing. 8. Changes in daily eating patterns and digestive comfort. Changes in your daily eating patterns and digestive comfort can reveal crucial insights about stomach cancer development. Unlike temporary digestive issues that come and go, these changes manifest as a persistent transformation in how your body handles food and liquids. You might notice increasing difficulty with swallowing, as if food isn't traveling smoothly down your digestive tract. What starts as occasional trouble can progress to regular episodes where even liquids become challenging to consume. This disruption occurs because stomach cancer can affect the muscles and nerves controlling your digestive process. Imagine your digestive system as a sophisticated conveyor belt. When cancer interferes with its normal operation, the smooth flow of food becomes increasingly difficult. You might experience a sensation of food getting stuck or moving unusually slowly through your system. This often accompanies persistent nausea that doesn't follow the typical patterns of stomach upset. Regular vomiting might also develop, particularly if the cancer affects the stomach's normal emptying process. Unlike the vomiting associated with food poisoning or stomach viruses that typically resolves within days, this symptom persists and may worsen over time. What makes this sign particularly significant is its progressive nature. These changes typically don't improve on their own and may become more pronounced as weeks pass. When combined with other symptoms we've discussed, these daily disruptions to eating and digestion serve as vital indicators requiring prompt attention. Understanding risk factors and prevention. While recognizing symptoms is crucial, understanding risk factors helps put these warning signs in context. Several factors can increase your likelihood of developing stomach cancer. These include a family history of gastric cancer, previous stomach surgery, infection with H. pylori bacteria, and lifestyle factors such as smoking, excessive alcohol consumption, and a diet high in processed foods. The impact of lifestyle choices. Your daily habits play a significant role in stomach cancer risk. A diet rich in preserved salty foods and processed meats significantly increases your risk. Conversely, consuming fresh fruits and vegetables, maintaining a healthy weight, and staying physically active can help reduce your risk. The connection between lifestyle choices and stomach cancer development underscores the importance of making informed dietary and lifestyle decisions. Time-critical response. The progression of stomach cancer emphasizes why early detection matters so much. When caught in its early stages, stomach cancer responds much better to treatment, with significantly higher survival rates. However, as the disease advances, treatment becomes more challenging and outcomes less favorable. Taking action and next steps. If you're experiencing any of these warning signs, particularly if they persist for more than a few weeks, it's crucial to get proper medical evaluation. Early detection through appropriate testing, especially upper endoscopy, provides the best chance for successful treatment. Remember, these symptoms don't automatically mean you have stomach cancer, but they deserve proper medical attention to ensure your health and well-being. Science tells us that stomach cancer, when caught early, can be treated successfully in most cases. Understanding and paying attention to these warning signs isn't about living in fear, it's about being informed and proactive about your health. By knowing what to watch for and taking appropriate action when concerns arise, you're taking an essential step in protecting your health and potentially saving your own life. If you found this information valuable, be sure to hit that like button, leave a comment, and share this video with anyone you think could benefit. And don't forget to subscribe so you never miss another video packed with life-changing health insights.